to Medically Speaking. My guest today is Dr. Jill Owens, Chief Medical Officer of the Upper Allegheny Health System. Doc, thanks for joining us today.
My pleasure.
So you're relatively new in your role as the Chief Medical Officer, but obviously a well-known physician in the Southern Tier. But you take the position at a pretty interesting time, all things COVID, the staffing challenges that exist in healthcare. But before we get into some of those specific issues, just give us a sense how your time has gone and what's it like in your new position as the CMO.
Thank you. Yeah, it's certainly been interesting to say the least. In my 25 years in medicine, I don't think I've seen a time when healthcare has been so stressed, and rural areas especially are taking it particularly difficult challenges and things. The COVID crisis has hit us just like it has the urban centers, but we have some unique challenges, which we'll talk about. The staffing crisis, the same. The Great Resignation, we're losing people in our workforce, and it's made it hard to take care of patients in general. I think it's important to step up, and which is why I did step up and take the leadership role so that I could continue to make sure that we had strong leadership and face the challenges that we're facing and try to help solve them going forward.
Yeah, it's great to hear. You can sense the pride when you speak. You mentioned you're from the community, you live in the community. For the viewers who may not be aware, what is so different with rural healthcare? What are the challenges? Are there really major differences when you look at Olean or Bradford versus, say, South Buffalo Mercy or Buffalo General?
Yeah, definitely. A lot of the challenges may be the same, but there's some unique issues that rural settings face. For instance, with the staffing crisis, the bigger centers probably can shift around and adjust staff to maybe, broaden their ability to take care of patients a little bit more. But we have such small units and such small areas in the rural facilities that sometimes you're not able to do that. Also, there's less physicians. And so if somebody gets sick or somebody's out, you may have one doc specialty, and it's hard to sometimes backfill those gaps. I think, too, our communities tend to be a little more economically challenged. And we saw during COVID, especially, the vaccine rates were low. So a lot more sick patients, which ended up in the hospitals and the ICUs down here, which was a particular challenge for us.
Let's stick on the COVID-19 issue. You mentioned how that was especially impactful and challenged the health system and the community. Where does the health system stand today in terms of statistically COVID numbers, the patients that you're seeing, the types of COVID patients that you're seeing, say, versus a year ago or 2 years ago when COVID first hit?
Yeah, so we're in a much better place now. We're down the past few weeks here into single-digit cases in our health system. And in comparison, back in the fall, we were hitting 55 or so cases system-wide between the two hospitals. So much better. Also, I think we are much better equipped to handle the cases. I mean, the medical community as a whole nationwide has learned, protocols and things that are better to take care of the patients. So we're able to do a better job, and we're using those same protocols here. And again, we've made a commitment now for our staffing to be adequate, even if it involves some agency staff, which has helped us to be able to take care of those patients. And we're working on ways to move patients efficiently through the system, which COVID has impacted pretty significantly. And I think we'll be better positioned, for future waves to be able to handle those challenges than we have been.
So prior to the staffing challenges, and even say prior to COVID-19 really hitting the Southern Tier, the board at Upper Allegheny was in the midst of implementing a transformation plan for the organization to better position it for the future. There's been an awful lot of talk in the community about the transformation plan, what it means, what it doesn't mean, how it impacts the respective communities. But I think from your perspective, can you explain to the viewers really what's the philosophy for the transformation change, or what is really the need to change, and why is the board doing that?
Yeah, so healthcare is changing, right? So again, I mentioned I've been a physician for 25 years, and I've been in Bradford for 22 of those years. So in the system locally here a long time, and we're doing things different than we did 22 years ago when I started. A lot of the specialty services now go straight to tertiary centers. They don't get cared for in the rural communities. Things like trauma we did when I started here, we don't do anymore. And certain big surgical cases are also funneled. Even strokes and certain cardiac cases, there's a focus to get them to the tertiary centers. And on top of that, then a lot of surgical cases have shifted to the outpatient arena. So, you may have had your gallbladder done 22 years ago and stayed in the hospital for a week. Now that same case is done as an outpatient. And even orthopedic surgeries now, like big joints, are starting to be done as an outpatient by some of our newer surgeons. So less patients in the hospital, less admissions means less revenue. And the rural systems, again, they're small to begin with. They have to figure out how to redevelop themselves and transform into something that's sustainable for the future.
So let's talk about some of those issues in particular that have come up. And you mentioned a few. The loss of beds at Bradford, the debate over the 20 beds, should we have 20 inpatient beds or not? If you can, explain maybe what the average daily census is these days at Bradford, and how things like the change to outpatient, like you mentioned with orthopedics, how there may or may not be a need for, say, 20 beds versus 10 beds or 5 beds versus 15 beds.
Right. So, I think one of the things, and I wasn't involved in administration when they looked at this, but I was involved in taking care of the hospital patients directly then. And our census at Bradford was really running probably around 20 or less patients on a regular basis for several years before the transformation plan even was thought about. So again, with the decrease in census from all those things I mentioned, we have to adapt and be able to adjust the system to be able to financially move forward and be sustainable for the future. So I think that's the decision behind the 10 beds. When COVID hit now in the fall and stuff, like I mentioned, the cases went up. We had to increase our capacity, and we did that first through the surge plan through the state, and then formally asking for additional beds. And I think, again, one of the things that's very important is being nimble going forward and looking at the current situation and where the future's going and trying to stay on top of that. I think another good example of that is ICU care. So, we hear a lot about, and I'm sure patients and the community members are frustrated that we don't have an ICU. But, again, being one of the people that took care of those patients for years, we really weren't doing true ICU medicine for the most part, except in a few rare cases in Bradford. We were taking care of some sick patients, but we would usually stabilize them and send them to a tertiary facility to keep up with their critical care. And that's one of the things, doing that safely is important for the patients. I mean, if I was a patient or my friends and family that live in the region, I wouldn't want them to be getting substandard care by doctors that aren't equipped to take care of those critically ill patients. And I think the decision there was Olean, for a multitude of reasons, already had a critical care doctor that's board certified and trained to take care of those types of patients, and that's all they do. And so that's why this system, leaned towards sending those patients over there. We hear a lot of complaints that other facilities around us, similar to Bradford's size, still have ICU beds. But if you look, I would say that they're probably in the same state that Bradford was a year or two ago. Very few true critical care patients in those beds, and no doctors in the building sometimes in some of these hospitals to manage those patients. So if somebody crashes, you're scrambling to get them out. Whereas at least in Bradford, we have a board certified ER doc in the building all the time, 24/7, which a lot of the other hospitals don't have. And I think being able to stabilize those patients and send them to a place like Olean, where we have an intensivist all the time that can help manage those patients, is really beneficial and safe, good quality care for the patients, which at the end of the day is what we want.
Sure. So when you hear the criticism, Olean is benefiting at the expense of Bradford, you seem to take umbrage with that type of characterization of, pitting one community versus the other.
Yeah, I mean, I can understand that people want every service in every community. I get it. I'm from Bradford, and I wish I could have everything there at my fingertips too. But again, we have to be able to do it safely, and that's really what it comes down to at the end of the day. Now, we did move some services to Bradford. In fact, part of the initial plan that we've executed already since I've been in board is bringing the sleep lab over to Bradford from Olean, and also bringing occupational health over. Those are things that we can actually, we were doing better in Bradford, and we can do them better and safely in Bradford. And so those are services that have moved from Olean. So again, it's not about who gets what, but really what can we do safely where to benefit the community. And really within a 20-minute radius, either direction, you have all services. And that's allowing us to recruit in new physicians that we probably wouldn't have been able to recruit, had we not had that consolidation and regionalization of care like we've been doing.
So I'll ask you one more question on Bradford specifically. If you can, tell us more about the access to key services or core services like neurology or cardiac or oncology, because the average community member or even a viewer who may be watching this, they may not understand, what types of services are available at Bradford versus what may be available at other smaller rural community hospitals across northwestern Pennsylvania.
Yeah, and this is one of the things that I think I'm most proud of. So we've been able to recruit a lot of docs in specialties that small community hospitals like ours and specifically the ones around us aren't able to get. They might have somebody that comes from a tertiary center and spends a half a day or a day a month or a half a day or a day a week seeing patients, but we actually have been able to get some of them to come in, live in our communities and practice at both hospitals. So for instance, we were very successful recently in recruiting a pulmonologist, Dr. Sheik, who will be joining us in both Olean and Bradford with office hours to see patients. And, right now with the COVID challenges and people having long-standing symptoms after their COVID illness, sometimes having a pulmonologist is key. And she'll be the only one in the region. And in fact, in my 22 years here, we have never had a full-time pulmonologist at Bradford. They did have one in Olean, but not in Bradford. So now you'll have access to that service. We've also been able to get oncology services in. We have a new doc, Dr. Schofield, who's starting with us actually last week. And again, the regionalization has helped us to be able to get him here because he can practice at both communities. We have a little larger population and a little more capacity. Orthopedic surgery is another area. So we've had some retirements of some wonderful surgeons that have been with us in the past. And again, a lot of places struggle to have a doc, just one doc, let alone. We're going to have 3 board certified orthopedic surgeons, and 2 of them will have full-time office hours in Bradford so that we have a doc covering all the time in the Bradford office as well. And that's Dr. Ashi, who joined us in September, and then Dr. Panko, who just started in February. So some exciting stuff. And that's just the tip of the iceberg. We have some other recruits in the pipeline that I think the Bradford community and the Olean community working together can secure those docs to come in and provide services that we really haven't had before.
So let's take a step back. When you talk about that, despite staffing challenges, despite COVID-19, despite being in a rural community, that may be economically challenged in some cases, you guys are finding success in recruiting physicians to come to the southern tier. That's got to make you happy. It's got to be a point of pride for you guys.
Yeah, it's super exciting. Like I said, and I don't think we could have done it without a lot of things. The collaboration with our tertiary partner in Kaleida, and then also the regionalization and being able to pull together a larger population of patients to draw those physicians in. Because again, a doc with that skill set, especially some of those specialized skill sets, if they go to too small a community, they won't have enough patients to take care of. And by, expanding our population a little bit with the regionalization strategy, we've been able to bring them in. And I mentioned some that are going to be coming or have come in recently. We also have some partnerships. Dr. Zuprik is coming, UB Neurosurgery partnership he'll be in only in 2 weeks doing surgery. And we have a PA starting with him that'll have office hours in both communities as well. Dr. Narayanan is a UB urologist who's joining us in partnership, again, to provide care in both the Bradford and the Olean community. And just so many things like that we wouldn't be able to do without the transformation that we've been able to accomplish.
So that transformation in terms of the work that you're involved in is really service line planning and making sure that you're meeting current community need as well as setting up future community needs or making sure that there's access to care. So if you can explain really what the philosophy is with your service line planning.
Sure. So this is one of the most exciting things to me. So as a physician, being here a long time, we've always just taken whatever docs we could recruit and then build the service around them, which, not ideal because sometimes they don't do things that you need. And so you end up having to send patients away for services that you should be able to do locally. And so we're starting to really look at the service lines from start to finish. What are we doing now? What should we be doing? What can we do safely? And then also looking out into the future, what is the needs of that specialty going forward? How is it changing? And like we talked earlier, what types of things will they be doing that they don't do today, or vice versa? What types of things do we do today that we won't be doing 5 years from now? And it really helps us to build and recruit a sustainable service that the community actually gets more care than that they've had before, better quality care, and really positions us going into the future. And it like I said, it's, as a physician, it's one of the most exciting things we're doing right now. And we're actually doing it very well. And the docs we're recruiting, that's why we're getting them. We talk about that. They get excited about it. They want to come join us. So I think nothing but good things coming.
Yeah, that's great to hear. We'll wrap up this question. It's been a long 2 years with COVID-19 and some of the challenges. What's your message for your fellow physicians, the nurses that have been there day in and day out, the other clinical staff, ancillary staff, those who showed up? What's your message to those who work for Upper Allegheny Health System?
Yeah, I think we just need to remind ourselves why we went into the services that we went into. So whether you're a physician, a nurse, or some other ancillary service taking care of patients, we went in to take care of people and serve the community and provide that care. And, it's been challenging. So I think all of us have experienced a little bit of a aha moment, like, wow, this has been tough. But I think if we come together as a team and band together and support each other through these difficult waves and challenges that we face, I think we're well positioned to provide the care to the region that we need to. And so I would just encourage everybody to lean on each other and become that team that we can to do the best job providing safe and efficient care for our patients.
Great message indeed. Dr. Jill Owens is the Chief Medical Officer of the Upper Allegheny Health System. Doc, thanks for joining us today.
Thank you.